Hello everyone, it's me Dr. Sebu again, and today we will talk about a different topic. We will talk about things you may not know about the spine or back pain. So probably you don't know about it. And we will talk today about the fact that many people don't know that the images, the MRI or X-ray images you may have, it's not reflecting how bad is the condition of the spine. In another word, I want to explain that some people, they have very bad images on the MRI. They have degenerative disc disease, disc herniation, but they have minimal pain or they don't have any pain, and they continue living their life normally. And some people, they will have a small disc problem on the MRI shown, and it will cause them a lot of problems. This means that by seeing simply an image of an MRI, the doctor normally cannot decide how bad is the situation unless he has the history. What's the story of the pain? How long the pain is there? Where is exactly the pain? Is it extending to the legs or not? There is numbness, tingling sensation, and is it all the time there or it comes and goes? Many things may help the doctor know what's the problem. And also very important that the doctor examine the patient in the office. Then he can have an idea about the situation. The images may help, but it's not everything. Now, a lot of people I see in my work that they don't know this fact. How come that the images are not reflecting the reality? Most of the people think if I have a bad MRI image, I have a bad spine and I will suffer all my life. It's not true. So how we know about it? In the 90s, when the MRI machine was invented, it was a great achievement, and we started to see very clearly everything in a millimetric precision. So in many places in the world, in many countries, studies were done. They took people, they don't have any back pain, and they did an MRI to these individuals, and they found that about 30 to 40% of them, they have abnormal findings, which means on the MRI they may have a disc which is dry, degenerated, black disc, or even a disc herniation and compression of a nerve, and these people, they don't have any pain. So from that time, we know that if we see something on the images, not necessarily means that the patient is suffering with that, okay? So the second thing that we started to understand that the changes on the images basically are determined by somebody's genetics. That means some people, they will have more problems on the images than other people, depending from the genes they carried from their parents or grandparents. How we know about this? There are many studies done, but the most interesting and significant studies is the twin spine studies. These are multi-centric studies. That means in many centers in the world the study was done, and but the biggest contribution was from Finland. In Finland, the health system, the records, the data is all recorded. So there, at the time of the study, about 20 years ago, there were about 10,000 twins. From these 10,000 twins, 600 was chosen. And why we study twins? Because when we study twins in medicine, we know that these people, they have exactly the same genetic codes. So we can know how much the role of the genetics is responsible in one disease. So why they chose this 600 from the 10,000? Because this 600, the twin brothers, or sisters, of course, they were having very different lifestyle and very different work. So someone was having a hard physical work, the other brother or sister was having office work, and etc. So when they studied this big sample of people, at the end, the conclusion was the genetics was the most important factor. It was not important what you are doing really in life, or it was minimal contribution. The most important was genetics. Now I will show you some pictures there of MRI of brothers and sisters. You see in the first image, the first one is a farmer and the other one is a driver. And you see basically it's the same picture. You think it's belonging to the same person. You see here a bus driver and the carpenter. The third one is a journalist, and the other one is a farmer, 44-year-old. And you see nearly the problem with the disc. We see the same disc is sick in both individuals. Okay, so of course aging is very important thing also. So but the aging, that mean some people, they will have gray hair in the same with aging. With the same way, the disc or the spine will change. It will be like dry, and it will be manifested as a black disc, we call it. The disc color will change. So this is not necessarily will give any pain. It's a simple physiological or normal condition. Okay, so let's move on now. Another aspect why it's not very informative, the images of the MRI, to know if someone having a problem just by looking at the image. We don't know this person, is he having good muscles? The load of the body is not coming only on a disc or a bone or a joint. There are muscles which are balancing the spine and holding, and most of the load is coming on the spine, on the muscles. So we see this in our practice as a pattern. We see athletic people or people who do regular exercise, they may have very significant changes in the spine. So they have bad MRI, but they have most of the time minimum symptoms or no symptoms. And on the other hand, we see people who they have extra weight, don't exercise, they may have a small changes in the MRI and they suffer a lot. So these are the reasons maybe why there is no matching between how bad is the image and how bad is the problem of the patient. Now, so what consequences from this fact can we have? What are the problems we face with this fact? We have a phenomenon now, we call it vomit. Vomit is a victim of modern imaging technology. This is a term was coined by a British doctor about 15 years ago, and showing that some people, they will suffer and become victim because the images or the pictures are showing a lot of things which are not important, let's say. Okay, so these people, let's have a classical story. Someone will have a back pain. It's very common, like 80 to 90% of people, they will have back pain one day, and this pain most of the time in 2 maximum to 3 months it will go away by itself. We know that, but we know now that the medicine is available. People will have back pain, immediately they will go to the hospital. The doctor will give them some medicine and reassure them most of the time, but some of them, they will be very anxious. Maybe I have a serious problem, I want to have an MRI, and I want to have an MRI, and at the end they will have an MRI, and on the MRI the report from the radiologist will come with a full page of findings, and the patient will start to panic. Oh, I have all these problems, and so I have a big problem. So this patient, most probably he will go and have a second opinion, third opinion. It's very easy now to have opinions because it's like shopping. There are more hospitals than shopping malls, and some doctors, they will tell them, you really have a big problem and you need a surgery. So some people, they will go for unnecessary surgery because of that. Now, what else? Some people, they will be afraid of moving because, oh, I have a problem, I must not move, otherwise I will injure my back. And this is one of the worst things you can do. If you're afraid of moving, your muscles will not work normally, and some people, instead of recovering by themselves with time, they will keep having pain. We call it the chronic non-specific low back pain. Okay, so knowing all this, I have 3 advices to give you that now you know about this fact. First of all, if you send your pictures, your back images, to a doctor abroad for a second opinion, for an opinion, you will never get complete right advice. The reason why, as I told you, this doctor or the person outside, he will not know your story. He will not know your clinical examination. If you move your leg in certain position, what pain it will give, etc. and etc. So this is why telemedicine especially like now in the time of Corona, it's very hard for spine pathologists. We cannot just by seeing an image tell you what is it. So in the same way, I receive a lot of like MRI reports, and they ask me how much costs the surgery. I cannot answer this question. So this is the first advice. The second advice, if for any reason you're having an MRI done for your back, don't go like most of the people and take a first opinion from Google. Google will complicate things to you. You will be more afraid of moving. We call it catastrophizing. So the best thing is take the first opinion from your doctor and then take a second opinion from Google. Third thing, if you have a back problem and you're going to see a doctor, and this doctor, he never touch you and examine you or ask you in details where is the pain, how it is, etc., etc., etc. He just look at the images and tell you, okay, this is your problem and this is your solution. Don't consider this a real advice. Don't trust this advice, and really find a doctor who will take your history clearly, and he will examine you and then look at the images and give his opinion. That's all for today, folks. Bye bye. Take care.